Hello, and welcome to another edition of Medicare Simplified with your host, Dave Miller.
Hello, everyone. Welcome back to another edition of Medicare Simplified. Today, our journey is going to take us down to Part C and D. And it all began back between 1945 and 1953 when President Truman saw a need for better health care coverage as well as more affordable for seniors. He started working on a program that today would be known as Medicare. Unfortunately, during his time in office, he didn't have the opportunity to sign it into law. And this program would sit on a shelf for a while. And then roughly about 9 to 10 years later, President Johnson would see this. He looked it over, thought it was a good idea, and he not only finished it off, but on July 30th, 1965, he signed it into law. And during that signing, he had President Truman and his wife Bess sit at the left side of the table. And prior to signing it into law, he looked over at them and said, "You know, you are the true daddy of Medicare." He signed it into law, and in recognition of their hard work, they were awarded the first 2 Medicare cards, honoring President Truman and his wife Bess. And I thought that was quite nice of them to do that. Now, Medicare Advantage didn't come around until 1970-ish. Somewhere in the 70s, Part C was born. Now, it wasn't really that good. It had some problems and only a 23% enrollment rate. So after a few years, they came out with Medicare Advantage and Medigap. And this had a much higher enrollment rate. Plus, it did better coverage and it was easier to explain and get people to understand how it worked and get them to enroll. However, there is no Part D as of yet. Part D didn't come into play until 2003 when President Bush signed prescription drug coverage into law. And when he did, he also signed up a late enrollment penalty. So what he did is he created this Part D plan with a penalty for not enrolling. He gave everyone from the time he signed that legislation into law until sometime in 2004 to enroll in a Part D prescription drug plan. And if you didn't, you wound up with a late enrollment penalty, which will be the next podcast. Now, Part C was complete. With Medicare Advantage added into prescription drug, you now have Parts A, B, C, and D, which is called Medicare Advantage Prescription Drug, or MAPD for short. Now let's take a look at Part D. Part D is your prescription drug coverage, and it comes as both a standalone plan for if you have Medigap, or you're on basic Medicare and just want a drug plan so you don't wind up with a late enrollment penalty, or it can come with a Medicare Advantage prescription drug plan at no extra cost. Now, not enrolling in these plans when you first have the opportunity to get into Medicare, or if you delayed your entry in Part B and D and C, then if you don't have creditable coverage, you will also be hit with a late enrollment penalty. And one thing that came with Part D, I don't know about you, but I could sure use a good donut once in a while. And I'm sure everyone enjoys them. That is, unless, of course, you hit the donut hole. So let's take a look at the different parts of Part D. The initial coverage period starts on January 1st every year, or when you first enroll in Medicare. And then you have the coverage gap, which is known as the donut hole. And from there, we go to catastrophic coverage until December 31st at the stroke of midnight. So let's take a look at these 3 categories in a little more detail. Initial coverage period is when your total of all your prescriptions add up to $4,660. Now that number comes from how much your copay is and how much the drug plan is paying. So if a drug costs $100, you're paying a $2 copay, the company pays $98, that $100 counts towards putting you in the donut hole. The coverage gap comes next. Once you spend 1 penny over $46.60, you end up in the coverage gap. This is where you will pay 25% of the total cost of all your prescriptions. The manufacturer will give you a 70% discount. Medicare will also throw in a 5% discount. However, to get out of the donut hole, the 5% Medicare gives you does not count. Only 95% will count to get you out of the donut hole and into catastrophic coverage. And that will be $7,400. And that is expensive, folks. Once you're in catastrophic coverage, you will only pay 5% for each of your prescriptions, or $4.15 for generic, and $10.35 for brand name drugs, whichever, of course, is more. Prescription drug plans come with 5 tiers. Some of them will come with 6. Tier 1 is your preferred generics. Tier 2 is your non-preferred generics. Tier 3 is your brand name drugs. Tier 4 is non-preferred brand name drugs. Tier 5 are your specialty drugs. These are very expensive on Tier 5. Now, some companies will offer a Tier 6, and these usually have drugs in them for chronic illnesses such as diabetes and other things. When you're getting your prescriptions, always find out if there is a generic available. Sometimes you can't get a generic drug for whatever it is you need. However, tier exceptions, and if a drug isn't in your formulary, exception to formularies are possible. You just need to talk with your doctor, have them fill out the forms, and they can send it into the company, and hopefully it'll be approved. So I know what you're thinking. If you have a lot of prescription drugs, what are you going to do? There are things known as prescription drug discount plans. Now, these are not prescription drug plans. They are just a discount card. And if that's all you have and you get in a drug plan later, you will be fined by Medicare as a late enrollment penalty. They are not insurance. It is just a discount card. Also, there are things called pharmaceutical assistance programs. Now, in Pennsylvania, they call it PACE. But you can check my website. If you go to migforyou.net, go to free services, you'll see find programs by state. If you click on that button, it'll take you to a website where you can find your state, click on view programs, and see if your state offers one of these programs. In Pennsylvania, on that same page I mentioned earlier, I have buttons there for you to enroll online, or you could do a paper application, whichever is easier for you. I hope this will help you understand the need to get a drug plan while you're eligible. If you're still working, that's fine as long as you have creditable coverage. When you do get Part B and enroll in a Medicare plan, make sure you have that letter of creditable coverage we discussed in a previous edition. Get a drug plan. If you're not taking prescriptions, that's fine. Get the cheapest drug plan you can find so that you are covered and don't have a late enrollment penalty. It's very important you do that. On the next edition, you'll see just how expensive they can be. I thank you for your time. This has been another edition of Medicare Simplified. I hope what you've heard today was informative and helpful. I look forward to speaking with you again soon and continuing our journey. Have a nice day. If you've enjoyed this podcast and don't want to miss future episodes of Medicare Simplified with me, Dave Miller, please subscribe wherever you get your podcasts. And don't forget to check out my book, Medicare Ready, Set, Go, available on Amazon in paperback and Kindle format. If you're looking for Medicare advice, please reach out to me at dave@mig4u.net or online at mig4u.net.